so repeal and replace together, and moving that forward at the same time. More broadly, Greg's spoken a lot about portability, health insurance, buying across state lines, being able to group both individuals and small businesses and to increase buying power. Pre-existing conditions are some things that I think pretty much everyone's in agreement on, keeping kids to the age of 25 kids.
Can I ask you something? I understand that there was a vote yesterday night that was in the Senate. There was actually voting to repeal the pre-existing and the keeping your kids on the.
I'm not familiar with what they did in the Senate last night, so, other than generally, I mean, they had a vote-a-rama until 4 a.m. or something.
And those were two of the bullet points. And the pre-existing, the stance that I have heard most of these people, and especially Paul Ryan, talk about is that there's supposedly a small percent of people under 65 with pre-existing, and that they will be dealt with by the state somehow. And I'm sorry, I don't mean to take over, but
No.
what I am confused about is it's looking to me like it's more important to Greg Walden as well as the other Republicans to repeal this thing that they like to call Obamacare, that's actually called the ACA, than it is to make sure that his constituents are healthy and not sick and have insurance. And this is what the perception is out there.
Okay. Well, I'm just telling you what I know as of today, and that's that the House, at least, looks like we're planning on moving on both of those at the same time going forward.
Okay,
So.
do you know what you don't know what they're trying to replace it with and why they're not making it public?
I don't have the details on it, no.
Is that going to be something that the American public is going to be privy to before they make this seamless
I'm sure it will
transition?
be, after how this all unfolded in the first place. It's a very rapid process.
Okay, so I know not all of the 20 to 30 million people that are needing this affordable care right now are in District 2, but there are quite a few people that rely on this health care. What is Congressman Walden planning on doing with those people that are going to lose all of their health care?
Well, let's take a step back for a second, because which piece of this are you discussing? I mean, in terms of, there's so many layers to this. When you say lose their health care, what do you mean?
I'm going to jump in there.
Yeah, go for it.
To us normal people, there's no layers. You're either insured, there's insurance available to you that you can afford, or there's not. The layers don't matter to the people. What matters to the people is that their families are okay.
And that they
so
could keep their
to
families
us
okay.
It sounds like
But it's
double
set,
talk.
right? So, who in here gets their insurance through Medicare?
I do.
Okay. Who in here gets it through an employer? Okay. Who gets it through Oregon Health Plan? Okay.
I get it through the ACA. It's private
So
insurance.
then, that's what I'm saying. How many of you are actually in the exchanges?
That's behind your
Yes.
spine.
So
That means through the healthcare.gov website.
So what's the purpose of this?
It's not just about us,
What's
it's
the
about
purpose?
No,
everybody
but
else.
I'm asking for perspective, because there's those three. Those are your layers
Okay.
within the law, right?
I
So
understand.
Medicare is a separate issue entirely. So then, but my question is then are you asking who loses out from OHP that's receiving it, or who that
All of
loses
it.
it from
What
the
about the
What
Medicare?
we're saying is
Donut
that the
hole.
Affordable Health Care Act made it affordable for millions of Americans who couldn't afford health care before the act to now have health care that they can afford.
Including Medicare.
And you want to take that away.
Including Medicare. Some people ended up on Medicare because that was where their income level was. They wouldn't have been. They wouldn't have been had they not.
Yeah.
Huh? I mean
Medicaid.
Medicaid. Sorry.
Yeah. No, it's confusing.
But
right?
so some people ended up, under a certain income level, ended up getting it through OHP. Other people got subsidies through private insurance. That's where I am. But you know, none of this was happening before the ACA, when all the rules were made by basically the insurance companies.
And Medicare has the donut, the prescription drug plan. It filled the donut hole, so what's going to happen to that? The seniors aren't going to have that
Prescription,
benefit?
the Part D,
Yes.
that's all separate from that.
No, it was
No,
part
it's
of the
not.
ACA.
Could I clarify?
But Part D wasn't part of the
Share your
ACA.
concern. All of us here on Medicare who have Part D prescription coverage, we've all experienced the donut hole, where for several months your prescription costs spike. And believe me, they spike. I take insulin, and if you've read anything lately about what it costs, my costs triple when I'm in the donut hole. Part of the ACA, which Congressman Walden wants to repeal in total, part of the ACA was the gradual shrinking of the donut hole. Every year it gets smaller and smaller, and then it will disappear in the next few years. That's going away. And I don't think seniors realize that yet, to a large extent, but it's definitely gonna hit people on Medicare.
So it made healthcare affordable for everybody, no matter what layer they're in.
A follow-up question would be, does Greg Walden have any idea of the amount of people that voted for him specifically in this district that will lose their health care? Has he done due diligence before he's made a decision about getting rid of health care?
Well, since we don't know who votes for us, I mean, I'm curious about you. I mean, just in terms of the impact of people in our district?
In terms of
You know the
numbers.
numbers of the people that voted and,
Percentage, yeah.
yes,
But
you know the numbers.
what do you mean who votes for you? We all vote. It shouldn't be just
Well,
people who
I was
vote
just
for you.
asking
that
he
was-
asked the question.
that was the
Yeah.
question.
Yeah.
This is percentage of the
Yeah.
vote.
Right. I think the question really is, might this jeopardize Walden's chance at re-election in 2018 if enough of his constituents lose their health care because he's repealing the ACA? This is a great question, I think, to bring to the congressman.
Sure, happy to pass
Because
that
I know that
along.
he's interested in being elected in 2 years.
And may I also add that it looks suspicious when you look at his list of donors, and so many health care companies are on it,
Insurance companies.
insurance companies. It doesn't feel like he's acting on our behalf. And I think that there needs to be transparency, and I think that his constituents would like to know where he stands exactly on all of this stuff. Is he on our side? Is he on the side of the
Healthcare companies. It sounds like he's chosen.
I
and
think I
we're-
disagree
and we're
with
really
that,
aware
but I
of
think
it
it's
now.
kind of a mischaracterization of it for sure.
Oh.
Now we can go around much of this district, and this conversation would be very different.
Doesn't make it right or wrong.
No, I'm not saying it is right or wrong. I'm just saying that
I think you'll be
we go out
surprised.
to any parts of our district where the constant refrain is, why is my deductible gone through the roof since this passed?
I can't hear you, could you speak a little louder?
Why has my deductible gone through the roof since this passed? Why are my premiums going up even if I am under, employer coverage?
What happened to the government option? We're gonna ask that question. The government option for the Affordable Care Act, which was supposed to keep the insurance companies honest and keep costs down.
And when people ask this from Walden, does he go and look at what plan they're under, what the deductible was, and what the plan is now, and try to tell them, explain the reasons? And the premium going up, it went up, but it went up higher in the past than it is now. Did he try to really talk to them and explain the answer to those questions and how this is working through and being better for them?
Or just try to fix the problem instead of throwing it all away.
Well, let's get to that point. I mean, I'm sure there's things in it that you guys don't like, because there's things
not
that Obama
perfect. It's
has,
not
right? I mean, there's things
Ton
that
better
we've
than what
repealed.
was before.
It's
No, I don't-
definitely
So-
not perfect, but it is way, way better than what we had before.
We
More
didn't have
better.
anything before.
Question about the,
We have
The insurance
Blue
companies,
Cross.
part of the ACA was that the insurance companies were required to provide certain coverage, like mental health,
Yeah.
CAT scans, for people over 65, I believe, who have a 30-year past history of smoking. That's required to be provided for free. How does he feel about the coverage, not just the cost? And when he repeals that, will mental health be repealed also? Will people not be, will the insurance companies not be mandated to cover those conditions?
Again, I'm not sure on the specifics of it.
And what about the 80% cap that was put, that they had to spend, that insurance companies needed to spend 80% of their revenue on healthcare to run away? Why are the premiums going up? We would like him to address that.
And I'd like to add one thing, which is that premiums were going through the roof before Obamacare. I can tell you that I was paying a third of my income to cover me because of a pre-existing condition, and it sent me into bankruptcy because the coverage was so terrible that my out-of-pocket stuff was
Were you in a
insane.
high-risk pool in Oregon then?
I was, but there shouldn't be a high-risk pool. I mean, the reason this stuff is happening at all is because Walden and the other you know, people are putting this in the hands of the insurance companies above their constituents, and then they're blaming Obamacare for prices going up when actually it's the insurance companies. Nobody's talking about reining in the insurance companies.
Yeah,
And
no
that's
one's-
what should be worked on, not,
No
not
one's talking about negotiating for prescription drugs. We pay an outrageous amount for prescription drugs in comparison to other countries, and it's been in the news about the price gouging. Why isn't that being addressed?
yeah.
That would help solve some of the cost problems in the ACA, the way to fix it. What this woman just mentioned, the 80%, keeping 80% for medical pay and just 20% for administration. How is that going to transition in the new one? That keeps them from gouging the public, making exorbitant profits.
I would just like to ask a big question that isn't about all the contents and the particulars, but it seems to me that we're putting, the Congress is putting the cart before the horse here. They're just gonna repeal the Health Care Act and not tell us what the replacement is.
Well,
I just,
well,
that makes no sense
How are
to
we
me
supposed
at
to
all,
sleep at night?
that they can
Right.
actually
They're going to
repeal
break
the whole
it.
thing
We're gonna break
and not say what they're gonna replace it with.
Or how much it's
That
gonna
just-
Yeah,
it
cost.
seems
the cost is being hidden.
insane
The
to me.
cost of
I'm sorry.
ripping that apart is being hidden from us,
Excuse
and
me,
I
I
know
think the
that.
cost is, what I had,
$3 trillion.
what I
Yeah.
wrote down here is,
Yes.
yes, $3 trillion.
And they're voting to hide that. from
Hide
the
that,
public.
exactly.
So
That's
why-
what I said.
It's like that is not democracy.
No, it isn't.
No,
And how can our representative vote to destroy something, whether it's good or bad or has faults or not, and just say we're gonna replace it? We're supposed to trust him
how are women
that they're
supposed
gonna
to take
replace
care
it
of their
with what?
Yeah.
With what?
pregnancy and birth control?
Well-
It's crazy. I
Can I-
spent,
Can I address her question first?
Yes.
Yeah. So I mean, that was part of what I was saying here at first. So the House hasn't voted on any of this yet.
But they've all said they're going to, right?
Well,
From the get-go.
we have for last Congress, but this Congress,
Right.
in terms of actually moving
no,
forward.
this Congress
This
voted
is-
last
Yeah.
night.
The Senate did.
Senate did.
So we know what everybody's intentions are, so
Yeah,
let's
okay.
just.
And we know
But
what-
and that's my point, is that
That's
that's
why
what the
we're here.
speaker has made clear, is that they plan on moving both of these things together, to your point of just getting rid of it and then not having anything lined up, moving it together, and that he also made a comment about the need and the plan for there to be a transition period so you don't end up with that situation. So I'm just
But
saying what
that's
I
not
tried.
an answer, you're just telling me exactly what I told you, that they're gonna repeal it, both houses are gonna repeal it, and then they're gonna decide how to change it.
They're talking
No,
about replacing
They're
it
not
with a
replacing it
giving
at
us
the same
an
time.
alternative.
and a health savings
No, that's what I'm
account
saying,
on
you're
insurance.
replacing it.
No, that's
So-
just your money.
What they're talking about replacing it with, so repeal and replace, what they're offering us now is to replace it with a health savings account. That comes out of my pocket. If I have any extra money at the end of the month, I would put that into a savings account, and then hopefully I would have about $100,000 in there if I had an emergency. That's what they're talking about replacing it with. So
Not
to
insurance.
say that
That's
they're going
absurd.
to repeal and replace, they're not replacing health insurance, they're replacing it with my ability to save money for an emergency.
And how can
Just-
how can you say that's not so when we don't have a plan in front of us that's the replacement plan in detail that we could see for ourselves how it's gonna affect everyone that's in the room?
All we're hearing is repeal. We're hearing repeal, we're hearing Obamacare is evil, and it shouldn't even, the fact that they're even calling it Obamacare when it's called the ACA is obviously meant to confuse people, because you know that half the country thinks the ACA is great and Obamacare sucks.
It's the same,
You know,
same program.
I mean, I just think there needs to be transparency, and because people, when they hear we're repealing it and maybe we'll replace it with, and we'll replace it at some point, we'll let you know what we're replacing it with, they're not able to sleep at night. And I can tell you from personal experience.
Yeah.
Could I ask you a question? It's just a little off what the conversation has been. When is the next time that Congressman Walden is gonna be in Medford for a town hall where any of us can get up and ask him a question? You know, and with notice ahead of time, so we know that he's gonna be here.
Yeah, we don't have anything scheduled this month, as far as town halls go, here in Medford or next month. But, at this point, we're just not that far out in our scheduling, cause things are kind of fluid.
How do we find out when, how do we find out?
We put notice out in the paper.
In the
And
paper?
And usually the news stations run it too.
Could it be on his website, a list of his town halls that he's given?
Yeah, he's got
Well ahead of
2013
time,
right
so-
now on his website.
Yeah.
It's not a.
That would
I
be a
don't know
nice
the
thing.
website, yeah.
Can we request?
Well, would you ask him
Sure,
to?
you can ask, yeah.
Ask him to
I
come?
can do,
Put
for
that
sure.
on your list?
So what I would actually like, Riley, and for all of our sakes,
Mhm.
because we all took the time out here today to come and see you, and we do believe that the congressman is working for us and that we're paying his salary. What would be very helpful is you're taking notes and you had a lot of questions that you didn't know the answers to. If you could find the answers to the questions, if you and I can stay in contact,
Sure.
I will let you know what the congressman says as far as the answers go, and also when we could meet with him.
Sure.
Because we would like to very much.
Okay.
If it's not a 1-on-30, then most certainly, we would like to know when he's gonna be in Medford. Because we're very, very clear that this is not gonna go away.
Celine, she
So-
has a question.
Riley, excuse me, it's 2:30.
Okay, yeah, thank you.
You mentioned
have a-
there seems to be a newsletter, is that current?
Is that about, he tries to do about once a week.
Okay. So I don't
You can
think-
sign up on the
Right,
website,
yeah.
you can click.
Would you make a note that the next newsletter could attend to these questions that we've asked, so we can get some answers quickly